Greetings, students. Hope you're doing well, and our semester is just going along. So today we're going to be talking about chapter 19, which is called Hidden Faces of Substance Use Disorders. So we know that special needs populations are offenders who have significant problems in the areas of some aspect of mental health, mental intellectual capabilities or capacity, and or medical needs. And so the objectives in reviewing the objectives for this chapter, we're going to be looking at understanding substance abuse disorders within the context of homelessness, military, LGBTQ, and ethnic minority communities. We're also going to be trying to comprehend the impact of SUDs on those with a disability. So, substance abuse is both a cause and a result of homelessness, often arising after people lose their housing. Alcohol abuse is more common in older generations, while drug abuse is more common in homeless youth and young adult generations. So people who are homeless often turn to drugs and alcohol to cope with their situations. And so substance abusers who are homeless have different needs than those who are housed. The substance use disorders comprise the most common category of psychiatric diagnosis for the homeless. Persons with substance misuse and mental illness indirectly contribute to the problem of being homeless. Alcohol is a common substance of misuse among the homeless. And the research shows that 26% meet the criteria for moderate to severe alcohol use disorder, and 65% meet the criteria for moderate to severe substance use disorders. So treatment challenges include, when you're dealing with the homeless and drug problems, the treatment challenges include that they have a series of medical problems that need to be addressed, the difficulty in keeping appointments, lack of insurance, they have lack of documentation. They don't probably have an ID or some kind of identification, lack of transportation because, the program may be halfway across town. Obtaining prescribed meds, are they next to the pharmacy? How do they get a hold of their medications? And particularly homeless people have children, and that complicates the situation even more. So obstacles to recovery, in addition to the ones that we just said, include that they have an increased risk for violence and victimization, and they have frequent recycling between the streets, where they go to a program, then they go back to the streets, or they go to a house, some kind of housing program, and they go back to the street. That's what that means. And jail and emergency rooms. For homeless people, substance abuse co-occurs with mental illness. People with untreated mental illnesses use street drugs as an inappropriate form of self-medication. In the modern U.S., military drug use surfaced as a problem during the Vietnam War in the late 1960s and early 1970s. Heroin and opium were widely used by service members in Vietnam, partly to help them tolerate the challenges of the war environment. 43% of those who served in Vietnam used these drugs at least once, and half of those who used were thought to be dependent on them at some point in time. Marijuana has been the most widely used illicit drug in active duty component of the military. And so the end of the Vietnam War, they began testing, and at the end of the draft, all contributed to the reduction in level of substance misuse among active military personnel, because it was like policing. And so once they started giving the urine tests and people were off, out of, as long as they were in the military, they were being monitored. But once they left the military, then that situation changed. Problems still exist today, with 20% of active duty engaged in heavy alcohol use, 47% of the population who engage in binge drinking, and 11% admit to illicit drug use and misuse of prescription substances. So in veterans, 32% have a diagnosis of an alcohol use disorder, and 20% have a diagnosis of a substance use disorder. So combat veterans are at increased risks for substance use disorders, as many turn to alcohol and drugs as a coping mechanism for combat-related stress conditions. So service members can face a dishonorable discharge and even criminal prosecution if they have a positive drug test, which can discourage illicit drug use. Only once they leave the military, that protective influence or barrier is gone, and substance use and mental health issues become of greater concern. So many veterans turn to substance abuse to self-medicate and numb their pain from the war memories or family life or whatever it is that they're trying to deal with. More than 20% of the veterans with PTSD also suffer from an addiction or dependence on a drug or alcohol. It is estimated that the sexual minority group members comprise between 2 to 9% of the general population, and surveys have found that sexual minorities have higher rates of substance misuse and substance use disorders than people who identify as heterosexual. So sexual minorities with substance use disorders are more likely to have additional comorbid psychiatric disorders such as depression, suicide, dealing with self-harm, and eating disorders. Treatment factors that are unique factors to this particular population include having to cope with homophobia, transphobia, family problems, violence, and social isolation. So there's clinical evidence that shows that substance use disorders, including tobacco use disorders, are prevalent in the LGBTQ population, and 30% across all substance use disorders. As to the problem of meth use in the LGBTQ community, it is higher in the general population, particularly among gay individuals. Women who identify as lesbians or bisexual are more likely to engage in heavy drinking and develop an alcohol use disorder. Men who identify themselves as homosexuals or bisexuals are at risk for illicit drug use problems, with some exceptions. Evidence suggests that women who identify themselves as lesbians or bisexuals are more likely to seek treatment than gay or bisexual men. Barriers to treatment include the need for rehabilitation professionals to feel comfortable with this particular population, and for them to work with identifying with persons who identify themselves as LGBTQ, because there is a lot of stigma, stereotypes, and judgment going on. So 54 million people experience some form of disability, and 9% of them have both substance use disorder and a coexisting disability. 7 to 8 million people in the U.S. With an intellectual disability suffer disproportionately from substance use problems. And compared to substance abusers without intellectual disabilities, intellectual disability substance abusers are less likely to receive substance abuse treatment, and when they do, to remain in treatment. So individuals with disabilities often develop substance use disorders to offset the emotional and the mental disorders like anxiety, low moods, and physical pain that they're dealing with that accompanies their physical disability. Approximately 12.6% of the U.S. population has a disability, some form of disability. They form a subgroup in the U.S. that is underserved and hidden from view. Substance use disorders are more common among people with a disability than the general population. 62% of the disabled people have an alcohol use disorder, and 23.4% of them smoke. If a person with a disability is identified as having a substance use disorder, treatment and resources are very limited. Persons with addictions are more likely to become disabled either through accidental injury or through long-term side effects of the actual substance abuse itself, misuse itself. In 2017, it was estimated that 12.6% of the U.S. population had a disability, and the most common being cognitive, 4.8% had that. Independent issues with independent living, 4.5% had that. And hearing impaired or lost, 3.6%. And issues of self-care, 2.5%. And vision disability, impairment, and blindness, 2.3%. So, regarding substance use disorders and ethnic minorities, and reviewing Native Americans and substance use disorder, while Native Americans account for only a small part of the U.S. population, these people experience much higher rates of substance abuse compared to other racial and ethnic groups. Native Americans may be at an increased risk for drug and alcohol abuse due to frequent exposure to lack of early prevention efforts. As far as in regards to Hispanic, Latino clients and substance use disorders, a rate 91% of Hispanic Americans with an SUD are unable to receive the treatment that they need at a specialty facility, and those who do receive treatment have poor outcomes. Many times they attribute this to needing culturally sensitive treatment programs that have bilingual services and are familiar with the cultural values of this particular group, and they acknowledge that in the treatment process. And those regarding Asian Americans and SUDs, in recent years, club drugs like ecstasy, LSD, meth, and ketamine have become popular among younger Asian Americans in urban areas. And substance abuse is not the only form of addiction in Asian American cultures. Compulsive gambling is an addictive behavior and affects many Asians when they're going in for treatment. And in regards to the African American population in substance use disorders, the rate of alcoholism use is 43.8% in African Americans. So African Americans are overrepresented among drug abusers in the United States, but they are also more likely to seek treatment for their drug addiction. But studies show that this population experiences less favorable outcomes upon the completion of substance abuse treatment. So even though they seek it at higher levels, treatment at higher levels, they don't necessarily come out with favorable outcomes. So it says that although African Americans make 12.5% of illicit drug use, 33% of drug incarcerations are Black. This leads to the roadblocks in treatment for substance abuse because there is a fear that if you go into treatment and you self-report, then someone's going to report you. Thank you for listening to this presentation. And there is a video included regarding a woman, and it's called When Drugs Steal Your Soul, A Homeless Woman's Journey. Please watch it and enlighten yourself. Goodbye.